With control of Congress and the White House, Democrats have an opportunity to bring down prescription drug prices, addressing one of voters' top concerns and finally fulfilling a campaign pledge Speaker Nancy Pelosi made to voters 15 years ago. Despite widespread support among Democrats, the idea has sputtered, however, as President Biden left it out of his infrastructure plan and is expected to leave it out of his budget while congressional Democrats remain noncommittal about how they might enact it. The initiative has fallen victim to extremely slim majorities and division among Democrats. Since at least 2006, Democrats have promised to drive down prescription drug costs by requiring Medicare to negotiate with drugmakers to get the lowest prices possible for the medications it covers. Over time, the policy proposal was expanded to include the private insurance market, allowing many more Americans to benefit from the lower rates. There would also be a new $2,000 annual cap on drug costs, and Medicare and drugmakers would have to explain significant price hikes. Dozens of rank-and-file Democrats lobbied the White House to include the price negotiation, as well as a large expansion of Medicare eligibility, as part of the infrastructure plan. Biden rebuffed their request but gave the policy attention in his first address to a joint session of Congress, urging lawmakers to get it done this year. The past two Democratic presidents started their ambitious runs at major health policy reform in their first weeks in office, to opposite outcomes. While President Clinton's plan fell apart, President Obama's became the Affordable Care Act. But Biden's administration has instead prioritized two other sweeping legislative proposals: a combined $4 trillion in infrastructure upgrades, tax credits and subsidies for workers and families, raising questions among some Democrats about the president's commitment to pursuing a plan to drive down drug prices. Prescription drug reform and Medicare expansion are not expected to be in the president's upcoming budget proposal, slated to be issued this week. White House Press Secretary Jen Psaki said health policy remains a big priority, even as her words made clear it's not an immediate one. Will every single thing he wants to get done in his presidency be reflected in his budget? It won't, she acknowledged. But that doesn't mean he's not committed to it, and it doesn't mean he doesn't have a desire to move all of these agenda items forward that he talked about in his joint session address and that he talked about when he was running for president. Outside groups and Democratic lawmakers are trying to build pressure on the White House to take action. Representative Pramila Jayapal, D-Wash, one of Congress's top advocates of prescription drug reform, said the White House wants assurance that the policy can get through Congress.